Hello, it's a very warm welcome to our YouTube channel again. This is Optimal Vision Recruitment UK and SG Education Nigeria Limited. If this is your first time of stopping by, thank you very much for stopping by. Please like, share, and subscribe to our channel. It doesn't cost anything. And hit the notification button so that you'll be able to know when we upload a new video. And then those of you who are returning subscribers, thank you very much for the time, for the effort, for the financial means you're using to support this channel by spending your time and energy and money. We're very happy to have your support, and we thank you very much. Please encourage your friends and colleagues to subscribe to this channel so that we'll be able to continue to grow and continue to bring you content. SG Education Nigeria Limited and Optimal Vision Recruitment UK partnered, and we are into legal immigration. We are into student admission to study across the world. We are into discussion of affairs that are of interest to Africans in diaspora, Africans who are also back home in the motherland, and general affairs. We discuss pulse once in a while, and we're very concerned about the welfare of Africans wherever they might be around the world. So this day we're going to discuss the opportunity available to a nurse who has bachelor's in nursing qualification. The opportunity to come to study in the UK, to work in the UK as well. The first opportunity I'm going to be discussing is the opportunity to come to do a Master's in Nursing program. This Master's in Nursing program is usually a one-year program, and there are start dates in January or February and then September. And attending that or doing that program, we enabled the BSc nurse to have a Master's in Nursing qualification. And because the UK now has this post-study work visa route, the nurse will also have 2 years post-study after they have finished their studies, during which time they can now work full-time. Meanwhile, while they are studying, they can work part-time during term time and then full-time during holidays. So when they have finished their master's program, they can then get the 2 years post-study work visa and write the exams needed to register with the UK Nursing Council. And obviously that makes them UK registered nurses. That's a fantastic achievement. Another opportunity available to nurses who have got BSc in nursing qualification is to come to do a Master's in Public Health program in the UK. We all know that public health is a very hot topic at this moment because of the corona pandemic, because of COVID-19 and all what it has done to public health all around the world. So public health is a very, very interesting program at this moment in time. And a nurse who's got a BSc in nursing program can come to do a Master's in Public Health, and that will help him or her to be able to get this qualification, decide either to remain in the UK after they have done their 2 years post-study work visa and apply to join the UK nursing register, or they might decide to apply to work with the World Health Organization, with UNICEF, or they might even decide to go and become ambassadors of various public health bodies internationally or nationally or regionally. So that's an opportunity available to nurses who decide to do the Master's in Public Health program. The third option is for the nurse to come to the UK to do a Master's in Health Management program. A Master's in Health Management program, as it sounds, is health management, so it will help the nurse to be able to be a leader in the profession, a top manager in the profession. And of course, after finishing this program, which is usually 1 year as well, the nurse will now have the opportunity to either stay for the 2 years, write the necessary exams to register to work as a UK nurse, or decide they want to do a PhD, or decide they want to return back to their country to take up national opportunities. These three programs mentioned so far, a nurse can also decide they want to return back to their country after the 2 years post-study and become a lecturer or become the head of nursing in whatever government, parastatal, or private enterprise they have in their country, if they choose to do so. Or they could decide they want to just write their exams required to register with the UK NMC and then work as a nurse in the UK. So that's three mentioned. We've got another one, and the other one could be a nurse can come to the UK to do a master's in business administration, because don't forget, nursing is something that is very financially intensive. The healthcare sector is very, very much financially intensive. So a nurse who's got a business qualification will also be able to manage a big organization, could be a healthcare organization, could be a hospital, could be a parastatal. So Masters in Business Administration is also another way for a nurse to come to the UK and be able to get this qualification. And the same thing applies. The nurse can also decide to finish the program, stay for the 2 years post-study work visa that comes, or decide they want to go back to their country after finishing the 2 years post-study, and then they will work in their country. The beautiful thing about these programs that I've mentioned is that the nurse, if they are married, can come with their family. They can come with their husbands, their wives, their children to the UK. Immediately they leave their country. As they apply for visa, they can apply for their partners, they can apply for their husbands, for their wives, for their children, as long as they meet the financial requirements. So these are the 4 ways mentioned so far. The last but not the least does not involve coming to study. It involves writing the 2 exams that are needed to register with the UK NMC, and these 2 exams are the academic IS exam, or the OET exam, and the CBT exam. If a nurse is able to write this exam, the academic IS, and is able to get band 7, 7, 7, and 6.5 in writing, so 7 in reading, 7 in speaking, 7 in listening, and 6.5 in writing, then write the CBT exam, they will also be able to come straight to work in the UK. And in most cases, they will have all expenses paid, and they will be able to get an employer from their country of origin that will fly them in, provide a temporary accommodation, and an excellent relocation package comes along with many of these job offers. If the nurse decides to go that route, that's another way of coming to the UK. So far we've mentioned 4 ways. Is it 4? I think it's 5. 5 ways of coming to the UK as a bachelor's in nursing qualification holder. The first one I'll recap is to come to do a master's in nursing program. The second one is to come to do a master's in public health program. The third one is to come to do a master's in healthcare management program. And the fourth one is to come to do a master's in business administration program. And the fifth one is to write the exams that are necessary, are required by the UK NMC to be able to come to work in the UK as a nurse. And you will be recruited from your country, you have your interview from your country, you pass the interview, you get job offer, you sign your contract, the trust or your employer will pay for your flight, provide temporary accommodation for you for 2 or 3 months, 1 month depending on the trust, and you have landed yourself an excellent opportunity to practice as a nurse abroad. So this is information we've got for you this day, and if you like what we're doing here, get in touch with us. If you want us to assist you with the study options, we can point you in the right direction for the academic IS and the CBT exam options. But if you want us to help you get admission without any hassles, get in touch with us. And the number to send us a WhatsApp message is +44 79 640 19341. The number again is +44 79 640 19341. And we look forward to receiving your text messages, your WhatsApp messages, and in due time, we'll be able to guide you to be able to come to the UK and do your masters in nursing, masters in public health, masters in healthcare management, or masters in business administration. Until we see you again next time, keep safe and keep looking after your patients and keep being an excellent example to everyone, an excellent nurse. See you next time. Thank you.